The orthopaedic consultant during an operation discussed with his male trainee how they like blowjobs. It was my first day in theatre. It was ridiculous that a senior surgeon should have pornography on his phone to show colleagues. Personally, I felt physically sick. We had the survey open for about 3 months in 2022, September to December 22. It was mainly consultants and senior doctors, so the junior doctors, though we tried to reach them, despite the fact there were no cookies on the computer, there was no way it could be traced, but even then they didn't feel confident enough to answer. And we specifically asked for what you've witnessed and what you've undertaken in the last 5 years. Our plan was really to present the results to those people with power to change things and see what would come out of that. And what came out of it was our report, Breaking the Silence. He began to rub his erection against my hip or buttocks while we were both scrubbed up and breathing heavily into my ear while I performed surgery on anaesthetised patients. After the report came out, women came up to me in my hospital and said, "Oh, I'm so pleased you've done this. Somebody needed to do something." And men came up to me in the hospital and said, "We had no idea this was happening." We still only have 15% of consultant surgeons in this country are women. But almost 2/3 now of medical students are women. And so if you're only picking the surgeons out of this increasingly small number of men who are qualifying as doctors, you are losing a lot of talent to the surgical profession. But also as a woman, I want to be able to choose a female surgeon if I wish. We don't know for sure, but we suspect that this toxic environment of training is why women leave surgery. It's one factor as to why women leave surgery. I looked into quitting, my mental health had plummeted, and I had very, very dark moments alone. Nearly 5 years later, I'm still in therapy. The other problem we have got is that it is still not safe to report. When you report this, it's more likely that your career will suffer, you will get moved on. The person who is perpetrating this is usually quite powerful in the organisation. What we thought might be an answer to that is anonymous reporting systems, so that even if there is no actual report that can go forward to a police or a GMC process, you are starting to get evidence about where the hotspots are. This consultant would pretend to dry hump nurses from behind whilst in clinic. He obviously thought this was very funny and said things like, "Oh, name of nurse, how can I resist?" It brings it back, your own training. You know, now I've been a consultant for some years, this doesn't happen to me anymore. And so I just assumed it had stopped happening. Even as quite a senior trainee in my 30s, I had an episode where a surgeon was touching the outside of my breast with his elbow. We were standing next to each other doing keyhole surgery, and I thought, is he doing that on purpose? And moved away. But then he moved and he did it again. And I thought, oh, he did it on purpose. You know, and you want to stamp on his foot and run away, but you cannot because you're operating on a patient. How was the outcome for that patient? What I was physically doing with my hands, would that have been better had I not been also trying to avoid someone who was doing that to me? No one wants to put themselves, their lives in the hand of a surgeon who cannot be trusted. They've even had someone who was accused of and convicted of rape who is not struck off as a doctor. I think when it comes to trust in the medical profession, which is what the General Medical Council is for, this is a major issue.
Subscribe to The Observer today to listen to the full investigation.